73% of people over 50 who die from stroke had normal systolic blood pressure the week before. I'm Dr. Valerie Stone, a practicing physician with 20 years of clinical experience, and what I'm about to tell you will change everything you thought you knew about blood pressure. The number you've been obsessing over? It might be the wrong one. The number your doctor barely mentions? That could be the silent killer sitting in your arteries right now. Today, you'll learn what most doctors never have time to explain during a 15-minute appointment. Write in the comments what scares you most about blood pressure readings and tell me what city you're from. This helps me understand how our thinking community over 50 is living and what concerns keep you up at night. Your answers matter more than you think. Let me be brutally honest with you. For decades, we've been trained to panic when we see that top number climb above 140. We've been told to celebrate when it drops. But here's what nobody tells you. That top number, your systolic pressure, is only one piece of a three-part puzzle. And depending on your age, your health history, and your body's unique architecture, it might not even be the most dangerous piece. Think about your blood pressure like a river flowing through a canyon. The systolic pressure is the force of the water when the dam opens. The diastolic pressure is the baseline flow when everything's calm. But pulse pressure? That's the violence of the surge, the difference between calm and chaos. And that difference can tear your vessels apart from the inside. Let me tell you about Margaret. She was 62 years old, a retired school teacher from Ohio. Margaret checked her blood pressure every single morning. She had one of those automatic cuffs, the kind that beeps and displays numbers in big green digits. For 3 years, her systolic pressure hovered around 135. Not perfect, but acceptable. Her doctor said, "Keep an eye on it, Margaret." So she did. Every morning, 135 over 70, 138 over 72. She felt fine. She walked her dog. She played with her grandchildren. Then one Tuesday morning in April, Margaret collapsed in her kitchen while making coffee. Her husband found her on the floor, conscious but unable to speak. The right side of her face drooped. Her right arm hung limp. By the time the ambulance arrived, 12 minutes had passed. 12 minutes that changed everything. At the hospital, the neurologist asked her husband about Margaret's blood pressure history. He showed them the log she kept, page after page of readings. The doctor looked at the numbers and said something that haunted him. Her systolic wasn't the problem. Look at the bottom number. It barely moved. Her pulse pressure was sky high. That's what did this. Margaret survived, but she lost her ability to read, something she'd loved her entire life. She spent 6 months in rehabilitation learning to walk again. All because everyone, including her doctor, focused on the wrong number. You see, pulse pressure is the difference between your systolic and diastolic readings. If your blood pressure is 140 over 90, your pulse pressure is 50. If it's 140 over 70, your pulse pressure is 70. And here's the terrifying part. A pulse pressure above 60 after age 50 is a stronger predictor of heart attack and stroke than systolic pressure alone. A study published in the Journal of the American Medical Association followed over 15,000 adults for 20 years. Those with pulse pressures above 70 had double the risk of cardiovascular death compared to those with elevated systolic pressure, but normal pulse pressure. Double the risk. And almost nobody talks about it. If this story made you think differently about those numbers on your monitor, support this video with a like and subscribe. That way, more people can learn how to truly protect their health. Now let's get back to what you need to know. So why does pulse pressure matter so much? Let me explain it in a way that makes sense. Imagine your arteries are garden hoses. When you're young, those hoses are flexible. They expand when water rushes through and contract when the flow slows. That flexibility protects them from damage. But after 50, those hoses start to stiffen. They lose their elasticity. Now when your heart pumps blood, the force doesn't get absorbed by flexible walls. Instead, it slams against rigid tubes. That's pulse pressure. That's the violence happening inside you with every heartbeat. When your diastolic pressure drops too low, While your systolic stays high or climbs higher, the gap widens. Your heart is working harder to push blood out, but your vessels can't relax properly between beats. It's like revving a car engine while keeping the brake on. Something's going to break. And in your body, what breaks are the small vessels in your brain, your kidneys, your eyes. Let me tell you about Robert, 67 years old, retired firefighter from Texas. Robert was proud of his health. He'd been on blood pressure medication for 10 years. His systolic pressure was controlled, usually around 125. He felt great. He went fishing every weekend. He helped his son build a deck. But Robert never paid attention to his diastolic number. It had been dropping slowly over 5 years, from 85 to 80 to 75. His doctor mentioned it once, said, "That's a bit low, but your top number looks good." One Saturday morning, Robert woke up with the worst headache of his life. Not a regular headache. This felt like someone was driving a spike through his skull. He vomited twice. His wife called an ambulance. At the hospital, a CT scan showed a hemorrhagic stroke. A vessel in his brain had burst. The neurosurgeon explained it to his family. His pulse pressure was too wide. The constant pounding weakened the vessel walls. Eventually, one gave out. Robert spent 3 weeks in intensive care. He survived, but he lost peripheral vision in both eyes. He can't drive anymore. He can't read without special magnifying equipment. All because a number he never thought about was slowly destroying him from the inside. Now, you might be thinking, okay, Dr. Stone, I understand pulse pressure is important, but what about diastolic pressure by itself? I've heard low diastolic pressure is dangerous too. You're absolutely right. And here's where it gets even more complicated. Low diastolic pressure, anything below 60, is dangerous for a completely different reason. Your diastolic pressure represents the pressure in your arteries when your heart rests between beats. That pressure is what fills your coronary arteries, the vessels that feed your heart muscle itself. Think of it like this. Your heart is a pump, but it's also a muscle that needs its own blood supply. The coronary arteries fill during diastole, during that resting phase. If your diastolic pressure is too low, your heart doesn't get enough blood. It's like trying to water a garden with a hose that barely drips. The flowers die. In your case, parts of your heart muscle start to suffer. Over time, this leads to angina, chest pain, and eventually heart attacks. A study from the European Heart Journal tracked over 11,000 patients with treated hypertension. They found that those with diastolic pressure below 70 had a 48% higher risk of heart attack compared to those with diastolic pressure between 70 and 80, 48%. That's not a small difference. That's the difference between living to see your grandchildren graduate and dying in your sleep at 65. But here's the cruel irony. Many blood pressure medications, especially the ones that work really well at lowering systolic pressure, can drop your diastolic pressure too low. You take your pill every morning like a good patient. Your systolic pressure comes down beautifully. Your doctor smiles and says, "Great job." But nobody notices that your diastolic pressure is now sitting at 58. And every night while you sleep, your heart is slowly starving. Let me tell you about Linda. She was 59, a nurse from California. Linda knew about blood pressure. She worked in cardiology for 30 years. When her doctor prescribed medication for her hypertension, she took it religiously. Within 3 months, her systolic pressure dropped from 150 to 120. She felt proud. She felt like she was doing everything right. But Linda started noticing something strange. She'd wake up at night with a tight feeling in her chest. Not pain exactly, just pressure. She mentioned it to her doctor. He ordered an EKG. It looked fine. He said, "Probably stress. You're a nurse. You know how it is." 6 months later, Linda had a heart attack while driving home from work. She managed to pull over and call 911. She survived because she recognized the symptoms immediately and got help fast. But at the hospital, the cardiologist found significant damage to her heart muscle. When they reviewed her blood pressure logs, the pattern was clear. Her diastolic pressure had been dropping steadily. For the last 2 months, it averaged 55. Her heart had been crying for blood, and nobody heard it. Linda's medication was adjusted. Her diastolic pressure came back up to a safer range, but the damage was done. She has permanent heart failure now. She can't work full shifts anymore. She gets winded walking upstairs, all because everyone celebrated the top number without watching the bottom. Now let's talk about systolic pressure, because I don't want you to think it doesn't matter. It absolutely does. Systolic pressure represents the maximum force your blood exerts against your artery walls when your heart contracts. High systolic pressure, especially above 160, damages your vessels in a different way. It's like a battering ram hitting the same wall over and over. Eventually, the wall cracks. Those cracks become plaques. Those plaques become blockages. Those blockages become heart attacks and strokes. The famous Framingham Heart Study, which followed thousands of people for decades, showed that systolic pressure is the strongest predictor of cardiovascular disease in people under 50. But here's the key point. After age 60, pulse pressure becomes more important than systolic pressure alone. Your body changes. Your vessels stiffen. The rules change. What protected you at 45 might kill you at 65. Think about it like this. When you're younger, your arteries are like fresh rubber bands. They can handle tension. They bounce back. But after 60, they're like old rubber bands that have been sitting in a drawer for years. They're brittle. They've lost their stretch. The same amount of force that they handled easily before now makes them snap. Here's a simple test you can do right now, wherever you're sitting. Check your last blood pressure reading. Calculate your pulse pressure. Subtract the bottom number from the top number. Is it above 60? If yes, you need to pay attention. Is your diastolic pressure below 70? If yes, you need to have a serious conversation with your doctor. Are you over 60 with a pulse pressure above 70? If yes, you're in a high-risk category that most people don't even know exists. Let me give you the numbers that matter. For people over 50, the ideal blood pressure isn't just about that top number anymore. You want your systolic pressure between 110 and 130. You want your diastolic pressure between 70 and 85. And critically, you want your pulse pressure below 60. That's the sweet spot. That's where your vessels are protected, your heart is fed, and your brain stays safe. But what if your numbers don't fit that pattern? What if your systolic is 140, your diastolic is 60, and your pulse pressure is 80? This is where most doctors struggle, because the guidelines don't give clear answers. Do you add medication to lower the systolic, knowing it might drop the diastolic even more? Do you reduce medication to raise the diastolic, knowing the systolic might climb? It's a tightrope walk, and you're the one on the rope. Here's what I tell my patients. First, never adjust your medication without talking to your doctor. Never. But second, understand that medication isn't the only tool. Your lifestyle has enormous power over all three numbers. And unlike pills, lifestyle changes can improve your pulse pressure and raise your diastolic pressure while lowering your systolic pressure. They can do all three at once. Let me break down the 5 most powerful strategies that work specifically for balancing all 3 pressure types. These aren't generic tips. These are targeted interventions based on how your cardiovascular system actually works after 50. Strategy number 1, reduce your sodium intake, but increase your potassium intake even more. Most people know salt raises blood pressure, but here's what they don't know. The ratio of sodium to potassium matters more than sodium alone. A study in the New England Journal of Medicine found that people who consumed 4,700 milligrams of potassium daily had significantly lower pulse pressure compared to those who consumed less, even when sodium intake was the same. Why does this work? Potassium helps your blood vessels relax. It counteracts the stiffening effect of sodium. It's like adding oil to a rusty hinge. The hinge doesn't just stop squeaking, it moves smoothly again. Your vessels don't just stop constricting, they regain some flexibility. Where do you get potassium? White beans have 1,000 milligrams per cup. Spinach has 800 milligrams per cup cooked. Avocados have 700 milligrams each. Sweet potatoes have 600 milligrams. Eat these foods daily, not as a side dish, as the main event. Strategy number 2, exercise, but not the way you think. High-intensity interval training is great for young people, but after 60, it can actually worsen pulse pressure in some people. What works better? Moderate intensity continuous exercise. 30 to 45 minutes of walking, swimming, or cycling at a pace where you can still talk but you're slightly breathless. Do this 5 days a week minimum. Why does this work? Moderate continuous exercise improves something called endothelial function. Your endothelium is the inner lining of your blood vessels. It produces nitric oxide, a molecule that keeps vessels flexible. After 50, endothelial function declines. Exercise restores it. A study in the Journal of Applied Physiology showed that 12 weeks of moderate exercise reduced pulse pressure by an average of 8 points in people over 60. 8 points. That's the difference between high risk and moderate risk. But here's the critical detail. The exercise has to be consistent. 3 times a week doesn't cut it. Your endothelium needs regular stimulation. Think of it like watering a plant. You can't water it once and expect it to thrive. You have to water it regularly. Your vessels are the same. Strategy number 3. Fix your sleep, especially your sleep position. This one surprises people. But studies show that poor sleep quality increases pulse pressure independent of other factors. And sleep position matters more than most doctors realize. Sleeping flat on your back can increase intracranial pressure, especially if you have sleep apnea. That elevated pressure translates to higher systolic readings and wider pulse pressure over time. What should you do? Sleep with your head elevated at least 30 degrees. Use a wedge pillow, not just regular pillows that collapse. Get tested for sleep apnea if you snore or wake up tired. Treat it aggressively if you have it. A study from the American Journal of Hypertension found that treating sleep apnea reduced pulse pressure by an average of 12 points within 6 months. 12 points from better sleep. That's more powerful than most medications. Strategy number 4. Manage your stress, but focus on the type of stress that matters most. Acute stress, the kind you feel during an argument or a scary movie, raises your blood pressure temporarily, but it comes back down. Chronic stress, the kind you feel from financial worry, loneliness, or caregiving burden, keeps your pressure elevated constantly. And chronic stress specifically widens pulse pressure by keeping your sympathetic nervous system in overdrive. What's the solution? You need a daily practice that activates your parasympathetic nervous system, the rest and digest system. Meditation works. But so does deep breathing, progressive muscle relaxation, or even just sitting quietly for 15 minutes. The key is daily practice. A study in psychosomatic medicine showed that people who practice 20 minutes of deep breathing daily for 8 weeks reduced their pulse pressure by 7 points on average. 7 points from breathing. No pills, no side effects, just your body remembering how to relax. Strategy number 5, and this is the one that shocks people most. Check your blood pressure at different times of day and track the pattern. Most people check in the morning, but your blood pressure isn't static. It follows a circadian rhythm. For most people, it's lowest at night and highest in the late afternoon. But some people have reversed patterns. Some people's pressure doesn't drop at night, a condition called non-dipping. Non-dippers have dramatically higher rates of stroke and heart attack. How do you know if you're a non-dipper? You need to check your pressure at night, around 2 or 3 in the morning. I know that sounds crazy, but set an alarm once or twice. Check it. If your nighttime pressure is within 10 points of your daytime pressure, you're a non-dipper. Tell your doctor immediately. This changes everything about how your medication should be timed. A study in the journal Hypertension found that taking blood pressure medication at bedtime instead of in the morning reduced cardiovascular events by 45% in non-dippers. 45%. Same medication, different timing. Massive difference in outcomes. Now let me tell you what happened to Margaret. the school teacher I mentioned earlier. After her stroke, after months of rehabilitation, her new doctor did something her old doctor never did. He calculated her pulse pressure from her old logs. He saw the pattern. He adjusted her medication. He added a small dose of a different drug at bedtime. He had her increase potassium-rich foods. He had her start walking 30 minutes every morning. Within 3 months, Margaret's pulse pressure dropped from 75 to 55. Her diastolic pressure came up from 68 to 76. Her systolic pressure stayed controlled at 130. She didn't have another stroke. She regained most of her speech. She learned to read again using audiobooks and large print. She got her life back. Not all of it, but enough. Margaret is 70 now. She still walks every morning. She still checks her blood pressure. But now she checks all 3 numbers. And she understands what they mean. Here's what I need you to understand. Your blood pressure isn't just 2 numbers. It's 3. Systolic pressure matters. Diastolic pressure matters. Pulse pressure matters. And depending on your age and your health, one of those 3 might be the most dangerous for you specifically. The tragedy is that most people never find out which one until it's too late. I'm begging you, don't let that be your story. Don't be the person who checks the same number every day while the real danger grows silently. Don't be the person who trusts that everything's fine because your doctor said your top number looks good. Your doctor is busy. Your doctor sees 50 patients a day. Your doctor is doing their best, but you have to be your own advocate. Here's your action plan starting tomorrow. Step 1. Calculate your pulse pressure from your last blood pressure reading. Write it down. Step 2. Check your blood pressure at different times of day for 1 week. Morning, afternoon, evening, and at least once at night. Track the patterns. Step 3. Schedule an appointment with your doctor specifically to discuss your pulse pressure and diastolic pressure, not just your systolic pressure. Bring your logs, ask direct questions. Step 4. Implement at least 2 of the 5 strategies I outlined. Start with potassium and exercise. Those give you the most benefit fastest. Step 5. Recheck your numbers in 4 weeks. See what changed. Adjust accordingly. Your health isn't something that happens to you. It's something you do. Every single day. Every meal. Every walk. Every night of sleep. You're either moving toward protection or toward danger. There's no standing still. Your vessels are either getting more flexible or more rigid. Your heart is either getting stronger or weaker. The choice is yours. But you have to make it with full information. In my next video, I'm going to reveal the 3 morning habits that destroy your blood vessels faster than high blood pressure itself. These are things almost everyone does. Things that seem harmless. Things your doctor probably does too. But after 50, they're silent killers. You won't want to miss it. Remember, you're not just a number on a blood pressure cuff. You're a person with a life, with people who love you, with grandchildren who need you, with dreams you haven't finished yet. Protect that. Protect yourself. Not with fear, with knowledge, with action, with the understanding that every heartbeat is a gift, and every day you wake up is another chance to do this right. Thank you for trusting me with your time today. Thank you for being part of this community that thinks, that questions, that takes health seriously. Stay strong, stay informed, and I'll see you in the next video.